Welcome to the Near Miss Maternal Mortality Flip Classroom session. In this presentation, we will cover a variety of organizational strategies that have been utilized in an effort to reduce maternal mortality and improve obstetric outcomes. The material covered in this presentation is derived from a series of articles, some of which have been provided to you for your participation in the Near Miss Maternal Mortality Flip Classroom session. The objectives of the presentation today are to describe the benefit of improved communication between providers. We will illustrate an approach to minimizing common causes of sentinel events by accounting for the most common root causes. Finally, we will review published experiences with comprehensive patient safety programs to give you an idea of what can be implemented at your home institution. So, what's the problem with the current system? Research studies indicate that healthcare providers may frequently witness, but not always report, problems with safety or clinical performance in labor and birth settings. Significant interpersonal and intra-team conflicts are likely to interfere with the ability to provide truly patient-centered care. Without having truly patient-centered care, there is a higher likelihood of a near-miss maternal mortality event or even a maternal death. Recently, 4 of the major organizations involved in maternity care have joined together to produce a blueprint to improve quality and safety for pregnant women. This collaborative editorial is meant to address concerns that healthcare providers may witness problems with patient care, yet not feel empowered to change the underlying processes. At its core, the editorial advocates for effective communication strategies to facilitate early detection and correction of potential near-miss maternal mortality scenarios. An analysis of sentinel event data from the Joint Commission has identified 4 major root cause categories. These categories include human factors, communication, assessment, and leadership. Within these categories, many subcategories of root causes exist. The task of addressing every potential cause of a sentinel event can seem overwhelming. However, a systematic approach to addressing these root causes can be created and implemented. The plan for implementation should take into account the clinical area of interest, for example, labor and delivery, as well as any institution-specific characteristics. In the example here, a variety of approaches are outlined to address miscommunication as a potential cause for poor outcomes. In the table, you will see potential miscommunication causes listed on the left, and a variety of approaches to address these miscommunication causes on the right. Here we see a continuation of the outlined approaches to address miscommunication as a potential source of poor obstetric outcomes. There are several examples of institutions that have created a comprehensive patient safety program and documented a reduction of maternal mortality and morbidity. While these programs do not utilize the same endpoints, much can be learned from the interventions that they have implemented and their outcome measures. In this first example of a comprehensive obstetric patient safety program, Grunebaum and colleagues report on the implementation of their program and the resultant effect on compensation payments and sentinel event occurrences. In the author's institution, a variety of interventions have been implemented to improve patient safety over a 7 to 8 year time frame. This process started in 2002 with an in-depth review and self-analysis. In the first full year of the program, fundamental training and communication skills were emphasized, occurring primarily in 2003. Interventions to improve patient safety were implemented in the following year, followed by formalizing protocols for high-risk medications such as oxytocin and magnesium sulfate, as well as protocols for delivery situations, including shoulder dystocia and operative deliveries. As the process of improvement continued, additional personnel were added to address areas of perceived need. These additional providers included a patient safety nurse, obstetric physician assistants, and laborists. Continued assessment of provider skills through certifications, drills, and continuing education assignments was also added. These interventions were meant to improve the readiness of the providers to respond to emergencies while reducing variability in clinical care through the use of protocols and checklists. The interventions over the study period led to a decline in the rate of sentinel events. The authors of this study defined sentinel events as maternal deaths and serious newborn injuries, including birth asphyxia and hypoxic ischemic encephalopathy. One of the outcome measures that the group used was the amount of compensation payments by year. Over the course of the study period, the authors documented a trend of decreasing compensation payments. While these values do not necessarily reflect the events of the year of payment, a decreasing trend suggests that a comprehensive safety program may decrease costs to the institution. A second example of a comprehensive patient safety program was outlined in a series of articles by Petker and colleagues. These studies looked at a wide variety of outcome measures, including a broad range of adverse events, employee satisfaction and safety measures, and liability cases. In the earlier study by Grunebaum, the cumulative effect of the interventions was assessed on the occurrence of sentinel events. These sentinel events are very serious, yet not particularly common, such as maternal deaths and serious newborn injuries, including birth asphyxia and hypoxic ischemic encephalopathy. In contrast, Petker and colleagues chose to assess the impact of their comprehensive patient safety program on a broader array of maternal morbidity and mortality outcomes. On the left, you will see the specific adverse outcomes measured. On the right, the figure provides a timeline of interventions along with a trend for the Adverse Outcome Index. The cumulative effect of the interventions can be seen to reduce the occurrence of a variety of outcomes, including several near-miss maternal mortality factors, as well as factors associated with fetal morbidity or mortality. Petker and colleagues also sought to understand the impact of their interventions on workplace dynamics, including measures that influence patient safety. The figure on the left demonstrates a significant increase in the perception of teamwork culture, while the figure on the right shows a similar increase in the perception of safety culture. Furthermore, the perception of improved teamwork culture and safety culture was shared by residents, nurses, and physicians/midwives, as shown in the figure on the upper left. An additional benefit was a significant increase in the perception of management, shown on the lower right, presumably related to the improved organizational culture. Finally, comparison of the first and second 5-year periods demonstrated a significant decline in the number of liability cases. An overall downward trend is seen over the entire 10-year period. In summary, organizational change can create meaningful, durable improvements in patient care. The assessment of this change can occur at a variety of levels. Sentinel events are serious yet infrequent, versus composite adverse outcomes, which encompass a wider range of more common near-miss mortality scenarios. Meaningful improvements were seen with either of these endpoints. Organizational change and a comprehensive patient safety program has also been demonstrated to improve team culture, safety culture, as well as have an impact on decreasing liability cases and compensation payments. Improved communication among all level of providers and proactive planning to address common causes of sentinel events can help reduce near-miss maternal mortality and maternal deaths.